Well, the medical thinking on cardiovascular disease, particularly plugged arteries, arteriosclerosis, atherosclerosis, is caused by elevated blood cholesterol, not enough of the HDL, not enough of the high-density lipoprotein, the good cholesterol, that people eat too much fat and all that kind of stuff. Well, here comes a case. Of course, I have to tell you that in 1971, I wrote a paper that was published in the International Pathology Journal out of Denmark. Acta Pathologica was actually translated into 6 languages, went around the world, and I actually compared, out of the 20,000 autopsies I did, I compared the amount of plugged arteries in vegetarians and vegans versus meat eaters. Guess who had the worst plugged arteries? It was vegetarians and vegans, because they eat all these stored grains in which the oils in the grains oxidize, turn into trans fatty acids, heterocyclamines, and acrylamides, causing inflammation of the lining arteries and plug them up. And so people who eat boiled potatoes and roast meats are going to have far less inflammation of blood vessels than those eating grains that have the oils in them have already started to oxidize. And then you add insult to injury and stir-fry organic vegetables with extra virgin olive oil, kind of like Steve Jobs and died at 56. Okay, well, the reason why this came up, there's an article in USA Today that says, The Curse of the Mummy, Hardening of the Arteries. A new study suggests that hardening of the arteries is an old problem, really old. Researchers have found clogged arteries and what's left of arteries in mummies from nearly 4,000 years ago. The findings from humans who lived before the invention of the Twinkies and curly fries are leading doctors to reconsider their notions about the cause of heart disease. Well, they wouldn't read my paper from 1971, but they believe the mummies. Okay. What they say is nearly 4.6 million Americans have arteriosclerosis, atherosclerosis, the leading cause of death in the developed world. And it says here that there was an article that came out in Lancet, the British Medical Journal. More than one-third of 137 mummies, about 44, 45 mummies sent through a CAT scanner, had calcification in their arteries. Okay? And the mummies came from Egypt, Peru, southwestern United States, and the Aleutian Islands. And they're sort of swirling around. They say, well, maybe it's genetic. Well, they've been saying it's genetic forever. They're still looking for the genes that are going to fix things. Well, basically, there's 3 different basic types of heart disease. The clogging of arteries, scarring of arteries, has to do, with, as we've said, with inflammation lining the arteries. Fried foods, processed meats, oils, even things like gluten intolerance will inflame those arteries, cause the arteries to respond and block themselves. Then there's cardiomyopathy of heart disease. I've done 1,700 autopsies on kids under the age of 10 that died of cardiomyopathy of heart disease. Wrote a paper on that one. It's in 2 Chinese dialects as well as in American scientific journals here, 1971. And I tell you, it's a selenium deficiency. It's a simple selenium deficiency. And then there's congestive heart failure, which is the most common cause of heart death in America and other industrialized nations. And it was actually discovered in the 1700s by a Japanese naval surgeon that congestive heart failure is caused by, you got it, a deficiency of a single vitamin. And I've had people have their cardiologist take them off of their medicine that they've been on for 3, 5, 8, 10, 12 years, on the heart transplant list for 3 years. In 1 week's time on these nutritional programs, the doctors take them off of 27 prescription drugs, take them off of the heart transplant list, because the heart has the capacity to heal itself given raw materials. And so myself, I haven't been to a doctor in 65 years. I'm not stupid, so I do my own physicals. You get that information from the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with coronary artery disease, learn how to deal with congestive heart failure, learn how to deal with the cardiomyopathy heart disease. These are all very simple nutritional deficiency problems. They're preventable and reversible, but doing a bypasses and stents might give you temporary relief, but certainly is not going to resolve the problem. You have to change your lifestyle, change your diet, supplement properly, all 90 essential nutrients, and also do what you have to do to give everything your heart needs to maintain and repair itself. You'll be amazed what your heart can do given the nutrients. The trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases, including cardiomyopathy heart disease, congestive heart failure, coronary artery disease, aneurysms, you'll be amazed what you can do simply with changing your lifestyle, changing your diet, and adding the 90 essential nutrients to your health program and supplementing extra with these nutrients. Again, get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, The Passport to Aromatherapy, and learn how to deal with over 900 different diseases, including the cardiovascular diseases, using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. The trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, The Passport to Aromatherapy. And I'm going to throw in, too, the omega-3 essential fatty acids. They, in deficiency or in a ratio disruption between omega-3, 6s, and 9s, will encourage thrombosis, coronary thrombosis, and the thrombotic stroke. So it's imperative that you take all 90 essential nutrients, including this one vitamin, selenium, and all kinds of nifty stuff to support everything, including copper. You got it, all 90. We'll be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie after these messages.
Do certain foods cause you to bloat or experience gas? Do you wake up in the middle of the night with heartburn? Are you forced to sleep on piles and piles of pillows to cut down on heartburn? Have you been diagnosed with acid reflux or gastroesophageal reflux disease? If any of these describes you, then you've got digestive problems. I was awakened with heartburn almost every night for over 20 years. Then I heard Dr. Wallach and realized all of the antacids I'd been using were actually part of the problem. My stomach acid wasn't too strong, it wasn't strong enough. So I started taking the ultimate enzymes from Longevity. Now all of the heartburn, belching, and bloating are gone, and I can sleep through the night without piling on the pillows. And I'm back to eating the spicy foods I love. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
Virtually every sector of the economy has slowed to a snail's pace. Huge publicly traded companies are laying off thousands of employees. Believe it or not, even the government is letting people go. However, one business industry is thriving, and that's healthcare. Pharmaceutical and health insurance companies are posting record profits in a near-depression economy. Americans are sicker than ever, and those companies are profiting like never before. You too can get involved in healthcare for just a one-time sign-up fee. Longevity is building an army of associates dedicated to saving America. Dr. Joel Wallach has educated thousands of people on the concept of do-it-yourself healthcare. With a little education, much of what is done in a doctor's office can be done simply and safely at home. Join Longevity and help save America. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
According to the CDC, nearly half of all Americans take at least one prescription drug daily. For those over the age of 60, almost 40% are taking at least 5 medications every day. Some of those drugs costing hundreds of dollars. Most people struggle to pay for these expensive drugs, but FDI Longevity has the answer with discount pharmacy cards. You can get a 10% and on some drugs up to an 85% discount, up to a 35% discount on hearing aids, and up to a 60% discount on lab tests, even ones for your pets. This card never expires, and best of all, the FDI Longevity card is free. That's right, I said free. Imagine the change in your life with extra change in your pocket. All because you're saving hundreds, if not thousands, on your medical costs with your FDI Longevity discount card. Contact your local FDI Longevity associate and find out how you could get your free pharmacy discount card. And remember, it's free!
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the pig pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Longevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. I just wanted to talk a little bit about breast cancer today, as I've got a story from ABC News that's headlined, "Diagnosed with Breast Cancer. Always get a second opinion," according to experts. And what they're talking about is a woman by the name of Judy Valencia, who she went in, had her, she was vigilant like all 37 other million women getting her routine mammogram. And she says she was vigilant about her checkups. And she said because her mother had had breast cancer and her sister had had breast cancer, and she had 3 aunts that had had breast cancer, and probably had her oncologist telling her that it was genetic and that she was predisposed to it. And so at one mammogram that they saw a slight abnormality, and then they went for a biopsy, and then based off the results of the biopsy, she was told she had cancer, and guess what? She got a double mastectomy, then later found out, oops, never had cancer at all. According to the American Cancer Society, say there's more than 230,000 new cases of invasive breast cancer every year. And according to Dr. Alyssa Port, one of the nation's leading breast surgeons from Mount Sinai's Newman Breast Center, she says women absolutely must get a second opinion after being diagnosed with cancer. She goes on to say that according to the Susan G. Komen Foundation, that they say they released a study a couple of years ago that says that about 4% of all breast cancer diagnoses are incorrect. And there's approximately 90,000 people living in the country with breast cancer that may have been misdiagnosed. So once again, something you always say, and that is get a second opinion. It doesn't matter whether it's breast cancer or anything else.
You're exactly right. In November 2012, the New England Journal of Medicine, they said 31% of breast cancer diagnoses from mammograms are false positives. 31%. It amounts to 1.3 million women have had their breasts cut off unnecessarily in America. And the worst year was 2008 with 70,000 false positives. Thank you, Doug. We'll be back after these messages. Okay, Doug, let's go to callers.
Well, let's head to San Antonio, Texas. And Jimmy, you're on with Dr. Wallach.
Hello, Jimmy, you're on the air.
Good afternoon, Dr. Wallach. Calling to give you a recap and update on my mother.
Okay.
We put her on the protocol 2 weeks ago for liver cirrhosis and 2 tumors that they found, 2-centimeter tumors they found in my mother's liver. And you asked me to give you a call if for any reason the radiologist claimed that they were cancerous. We went and they said it was cancerous. And now they want to do a radiofrequency ablation procedure and an angiogram. And I wanted to see what you recommended about that.
Okay, so it's still saying that these nodules in her liver are cancers? Are they benign tumors or what?
Correct.
Well, I asked you 2 questions. Which one is correct?
Well, they're saying that cancer is because of the mass being on top of the cirrhosis of the liver.
Okay. And so they're wanting to go in and give her focal chemotherapy where those nodules are? Is that what they want to do?
Well, it's not chemotherapy. It's the radiofrequency ablation. I guess they go in with a needle and they burn the tumors.
Okay, how old's your mom?
She is 75.
Yeah, I'd get another opinion someplace else. It sounds like a pretty harsh treatment for somebody her age, especially when she's debilitated with liver cirrhosis. And I'd want to know what those cancers are. It doesn't sound right to me that they want to go in and burn them. And she's already got cirrhosis liver. So I'd get another opinion. I'd take all, say, I want to get another opinion. I want all her lab works. I want to take the other lab works to another cancer doctor, another hospital at the other end of town. It has nothing to do with you guys. And so a second opinion is warranted here. And has she started the nutrition program yet?
Yes, she's been on it 2 weeks exactly tomorrow.
Okay, good. Has she begun to feel anything yet? Does she feel any more energy or anything?
Definitely. She's done a lot more walking because you had put her on, I guess, for the joints and pains and spurs.
Mm-hmm.
She's been doing a lot more walking.
Good. Okay, well, I'll tell you what. Yeah, make sure she's getting that selenium and the de-stress capsule. Stay away from all the bad stuff that puts a load on the liver. And I'd hold off on any sort of drastic treatment like that until you get a second opinion, and call me back with a second opinion. We'll be back after these messages.
Let's head to Venice, Florida, and Edna, you're on with Dr. Wallach.
Well, Edna, you're on the air.
Well, thank you, Doctor. I'm
Yes,
calling in regard to my father. He's 86 years old, and he weighs about 120 pounds. And he was diagnosed with Parkinson about a year ago, and then also diagnosed with posterior choroidal dementia about 2 years ago. He has spinal stenosis and muscular degeneration, and he takes drops for glaucoma. And he was recently diagnosed with a small stroke with partial seizures, and they say he's at high risk for more of those. And he isn't mobile. He has a hard time swallowing, so they have him all on liquid, Ensure of all things.
Well, that's the worst possible thing because it's made out of corn oil. Because corn oil oxidizes, turns into trans fatty acids. I would get as soon as you hang up, I'd get them off of that one. And we do have a meal replacer that's made from a whey and soy amino acid base. And I liked, in his case, I'd make it with heavy whipping cream instead of water. And I would throw in 2 eggs, and I'd have him take that twice a day. And you can either whip it up and freeze it and make a nice ice cream out of it. You can get vanilla or chocolate, or you can keep it liquid, and you can put it through a G-tube or have him sip on it for a couple hours for each meal. Okay, so that's I prefer that. In fact, it's just you're fighting a losing battle if he's being given Ensure. Now, when you say he's being given Ensure, I'm assuming he's in an assisted living, a nursing home, or hospice, or what's going on here? Where's he at?
He's in a nursing home.
Okay, are they going to give him what I suggest?
We're going to work on that.
Okay, because he's got 18 diseases here, and so it's not like it's a simple thing. This is something that needs to be monitored almost on a daily basis and tweaked each day because he has so many problems. But I want him to have 2, at his body weight, I want him to have 6 to 8 eggs a day. And, of course, they're going to freak out because of their little pea brains think cholesterol is an issue. Cholesterol is an issue. They've probably given him cholesterol-lowering statin drugs. They've had him on a cholesterol-restricted diet. And then they throw corn oil on top of it. Somebody needs to go to jail here. That's why he's got dementia, and that's why he's got Parkinson's disease. He needs to get on 1 healthy heart and brain pack per month. I'd cut that in half a dose of each of those 4 products at breakfast and half of the other half at dinner time. I'd give him 3 of our Ultimate Selenium twice a day. I'd give him 3 of our Ultimate Daily Tablets twice a day. I'd give him 3 of our de-stress capsules twice a day. And then because of the glaucoma, maybe some blood pressure, I'd throw in 3 of the Ultimate Daily Tablets twice a day. And then the Smart FX, 4 of those 3 times a day, 3 bottles a month. If you can get all that into him in a nursing home, I'll be amazed. Let's pray. We'll be back after these messages.
Let's head to Michigan. And David, you're on with Dr. Wallach.
Hello, David. You're on the air.
Hi, Doc. I just got to tell you, you are brilliant. Thank you for your life's work, and we need Wallach care, not Obamacare.
Well, gosh, thank you so much. How can I help you today?
Well, I'm calling for my wife, Doc. We've been on the longevity products for about a year, but we just kind of went gluten-free about 3 weeks ago. But my wife has been on antidepressants and Prilosec for 15 or 20 years. And then for about 5 years, the last 5 years, she's been on replacement hormones.
Mm-hmm.
She's off of those about 6 months. She's off the Prilosec. She's weaning off the antidepressants, and she just took a yeast test. She's got a yeast infection going on, and she thinks she has leaky gut.
Okay. Well, the leaky gut goes along with the gluten intolerance.
Okay.
So leaky gut is a manifestation of gluten intolerance. So the tighter she gets on the gluten-free diet, if you have a dog and cat in the house, can't be dry dog food because they're made from gluten. You can't eat gluten in the house, kind of thing. You can't have it in the house because crumbs get everywhere. You wash clothes together. So you have to have separate clothes for outside. If you're hanging around gluten-eating people outside, you can't wear those in the house. My wife makes me take my shoes off and come through the mud room when I come home, and so I've got to strip down and take a shower in the mud room before I get into the house in general because she doesn't want me dragging everything into the house.
Smart lady.
Yep, she is. And so that's what we got to do, that kind of stuff. But sounds like everything's kind of going the right direction. It's a time process. And how old is your wife, Dave?
She's 52.
Yeah. Okay, well, she, again, if she even considers she has leaky gut, then she certainly does have a gluten intolerance. And she's had it since she was an embryo. And so...
Right, she lost her appendix at about 6 or 7 years old.
Yeah, okay, well, that's another feature of gluten intolerance. So, yeah, and so it's going to take a few months on a gluten-free diet to begin to get optimal absorption. It might take 6 months or a year to get complete 100% healing. Okay. And this is you have to be ever vigilant. You cannot cure gluten intolerance, but you can manage it 100% and add 25 to 50 healthful, depression-free, reflux-free, and hormonal problem-free by getting on the proper diet and supplementing with the 90 essential nutrients. And it doesn't hurt with a history of depression, as we know, to the de-stress capsules and the selenium. And, of course, we have the Woman's FX to replace the HRT. And there's all these kind of things. It's a shift in lifestyle, and I just applaud you for doing this. The whole household is going to work for it. And if you have children, she has passed on the gluten intolerance to her children, your children, and so they have to practice the gluten-free diet also. Otherwise,
we're working on that.
Okay. Very good. Okay, well, God bless you.
What about the yeast, Doc? How do we get rid of the yeast?
Okay, are these vaginal yeast?
Yes.
Okay, what you want to do is get the tampons and use our colloidal silver on the tampon before you take it out of the applicator. Have her apply the tampon that's soaked in the colloidal silver at bedtime, and then wake up in the morning. She can take the tampon out and do that every day for 2 weeks, and that will kill the yeast. Of course, she needs the killer biotic, 3 of those twice a day. It's a blend of 8 herbs, and they all will support the immune system. 2 of those herbs are antimicrobial. They have the capacity to kill yeast, bacteria, fungus, viruses, and so on. And so you do it from the inside with the killer biotic, and you do it from the outside with the colloidal silver via the tampon. Okay?
Thank you, Doc.
You bet. And then give me a report in 2 weeks. She'll be a new woman. Okay, Doug, let's go to caller.
Let's head to Milwaukee, Wisconsin. And Mark, you're on with Dr. Wallach.
Well, Mark, you're on the air.
Hi, Dr. Wallach. Thanks for taking my call.
Yes, sir. How can I help you?
I'm calling about myself. I was diagnosed with celiac disease. So about a year ago.
Celiac disease? Mm-hmm.
Yeah. And, my stomach, it started with stomach problems.
Now, how long did you have, I'm curious, how long did you have symptoms before it was diagnosed?
Only for about 3 months. before the diagnosis. It started with, the real bad diarrhea, and then basically like 3 months of just constipation, really bad, and that's when
Okay, now when you were a kid, Mark, when you were a kid, did you have any asthma, bronchitis?
That's the strange thing. I had none of that. I was very healthy my whole entire life and never had any problems, never basically saw a doctor until this happened. So,
did you ever have any skin problems, no dry skin, eczema, dermatitis, psoriasis?
No, nothing.
Did you do you have rosy? Do you really have rosy pink cheeks, like kind of like a clown putting makeup on?
I think my skin color is about normal. Like I said, I mean, it just kind of all fell apart. All the wheels fell off about 3 months before the celiac diagnosis.
Yeah. Now, do you have brothers and sisters?
Yes, I do. I have a brother and 2 sisters.
Okay. Do they have any health problems?
Well, my brother was also just diagnosed with celiac disease a couple months ago.
What about your sisters?
Sisters are healthy for the most part, as far as I know.
I would check with them, because your mother passed it on to you 2 boys, and I guarantee you she passed it on to the 2 girls too. And the scary thing about the girls having gluten intolerance and celiac disease is that they will pass that on to their babies if they don't get on a gluten-free diet. They must, if they've already had children, then they've got to get their children on a gluten-free diet. This is passed on through the cord blood and the breast milk. Men can get this problem from their mothers, but they can't pass it on unless they're getting pregnant and having, breastfeeding their babies. So that doesn't seem likely. But what do you weigh?
I'm about 160. I'm about 5'10".
Okay. So at 160 pounds, what I would do is dose you for a 200-pound person, because you're closer to 200 than 100, and I'd have you take 2, and you have nothing else, no joint problems, no high blood pressure, no diabetes.
Well, I was diagnosed basically with a refractory celiac, so I've been on the gluten-free diet for about a year, but my stomach problems aren't going away, and I was diagnosed with intussusception.
Well, here's what I want you to do. What I want you to do is get a hold of that CD called Serial Killers, and the reason why I want you to get that CD, Serial Killers, it covers all the places that gluten is hidden. You may think you're gluten-free, but if you haven't resolved the gluten problem in a year and you've been working at it, you're missing something. It could be in dry dog food, dry cat food in your house, people living in your house who are also eating gluten and you're not, and you're washing your clothes in the same washer and dryer with theirs. The crumbs get all over your clothes. You put them on. You're absorbing that through your skin. They eat crackers on the couch, eat pizza on the couch, and there's gluten crumbs everywhere. And you sit on that same couch, put your hands on the couch, and rub your face. And so these are the sort of hidden places. They use wheat flour to thicken tomato soup. They use wheat flour to thicken gravy. They use breadcrumbs and cracker crumbs to hold meatloaf and meatballs together. They even have gluten now in yogurt and ice cream, because tapioca flour is too expensive to thicken those things anymore. So you need to really dig in there, look at that, get a hold of that CD called Serial Killers. Get a hold of the book, Hell's Kitchen. There's a whole section in there on gluten intolerance. And then call me every couple of weeks. Give me a progress report. We'll walk you through this. Don't forget the 90 essential nutrients. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And Doug, let's go to callers.
Let's head to South Dakota. And Al, you're on with Dr. Wallach.
Hello, Al. You're on the air.
Yes, Dr. Wallach. I'm calling for a 9-year-old female Cavalier King Charles Spaniel that's 20 pounds. She has epilepsy, arthritis, and stage 3 mitral valve defect.
Okay. So she had heart problems, she's got seizures, and what was the other one? What was the third one?
Stage 3, is it mitral valve defect?
Yeah, that's the heart problem. There was another thing there.
She's got curvature of the spine, too. Epilepsy, though.
Okay. Well, because she weighs 20 pounds, make sure the dog food she has is a dog food designed for toy dogs under 20 pounds of body weight. Don't just give her generic dog food, $5 sack of dog food from some big box store, because it's usually designed for a 35 to 50-pound dog. And then I would give her 1 scoop of our Arthrodex in her food, each day that has all known essential nutrients for dogs and cats. It's 1 scoop for 25 pounds of body weight, but even 100 or even at 20 pounds, I give her 1 scoop. And then, because she has this heart problem, I would give her one of our selenium capsules a day. Open that up and put it in the food, the powder, or just plop it down her throat and rub her little throat, and she'll usually swallow it. I do that after she eats. If you're going to put it down her throat, if you're going to put it in her food, well, go in that way. I would also give her the de-stress capsules. Give her one of those, either down her throat after she eats, or open it up and put the powder in the food. And because she has a spinal problem, I would give her 5 of our glucogel capsules. And again, you can either, I'd probably just open up all 5 of those once a day and dump the powder in her food. And because of the seizures, I'd have her take 3 of our Smart FX capsules a day. 3 Smart FX. It has the DHAs and the EPAs, which are the raw materials for the brain to make a neurotransmitter for proper nerve transmissions through the brain. And that's going to be your best shot in resolving all 3 of those problems. And she's doesn't sound very old, 9 years old. I'm assuming these problems have just come on recently. Is she on medication for these problems?
Yeah, she's on phenobarbital for...
Okay, phenobarb, for the seizures. Mm-hmm. Okay, well, let's see what we can do here, because this is a system that can support and promote healthy brain function, healthy cardiovascular function, and support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. And just remember, you can buy extremely expensive, very well-designed dog food for $100 an ounce. But if it's designed for a 50-pound dog, she'll not get enough nutrition from it. So you have to get a dog food that says on the label, designed or formulated for toy dogs under 20 pounds of body weight. Then you'll be hitting the nose, right on the button when it comes to the right dosage for nutrients. Then you throw in the Arthrodex, you throw in the Smart FX, the selenium, the de-stress capsules, and the glucogel, and of course the Arthrodex, 1 scoop per day. You're going to give that dog more nutrition than it's ever had in his life. And then call me every 2 weeks after you start that, and give me a progress report. Love to have it. And I know we only have a moment here, Doug, and I'm going to go ahead and take it and remind people to get a hold of the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. Save yourself, save your children and grandchildren, save your family, save your neighbors, your church mates, and your community. Become the local person that everybody comes to and ask them what to do for a particular health problem, and you'll be amazed. People will start coming because people are frustrated. Medical doctors have failed us. They kill, injure, and infect 15 million of their customers at the workplace every year. If any foreign country were to do that to us, we declare war on them. They are self-policing. They've become a protected monopoly, and it's very, very scary. We need to, get after the medical system for racketeering. They kill more people each year than the mafia has in 1,000 years. Well, stick with us. We'll be back another day. God bless you. Great job again, Doug and Billy, as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy Valencia here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewable, and besides that, they're not as good as tangy tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy Valencia. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. Many believe that all life began in the Earth's oceans. We do know that the oceans and seas are still abundant with life and life-sustaining nutrients. Many cultures have long believed in the life-giving properties of plants and sea life harvested from the oceans. Youngevity's Ocean's Gold is a proprietary blend of seaweeds, algae, mosses, kelp, sea cucumbers, and sea minerals, as well as coenzyme Q10, calcium, and iron, all designed to help support healthy thyroid function, regular heartbeat, normal weight, mood stabilization, and hormone levels. Take advantage of life-sustaining nutrients from the Earth's oceans with Youngevity's Ocean's Gold. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
With increasing rates of osteoporosis, it's becoming more and more evident that most Americans have low blood levels of calcium. Some would say,
I get all the calcium I need from dairy products.
Unfortunately, that's just not true. Besides, most dairy products are homogenized and can contain steroids and antibiotics that kill off good bacteria in the digestive system. Not to mention, the human body needs magnesium to make use of dietary calcium. That's why Youngevity developed OsteoFX Plus, containing bioavailable plant-derived forms of vitamin D3, calcium, magnesium, zinc, copper, and glucosamine sulfate. OsteoFX Plus is formulated to support healthy bones and joints. Not to mention, OsteoFX Plus tastes great, unlike other products that taste like chalk or dirt. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.